we're hoping to invite all kinds of people from around the city. That's what the campaign launch is about today. We want to spread the analysis that the Ontario Health Coalition's been providing on the Ford government's agenda, and we would like to make sure that as many people get out as possible. So we're inviting people to come out on the 7th of December to the Civic Centre at 11 a.m. and there will be speakers who will address the issues that we're concerned about. We've had real dollar cuts to hospitals again because they've announced increases of about 2%. But even the Ontario Hospital Association says that in order to keep up with inflation and population growth, those numbers should be going up about 4.5% every year. So that means we have real dollar cuts to our hospitals. Ontarians didn't vote for this. The government doesn't have a mandate for what it's doing to our healthcare system right now.
So this
they voted to end hallway medicine, and you don't end hallway medicine by cutting the funding levels for institutions that are already overstrapped.
Do you work in this hospital, the Civic?
I don't work at this hospital, no.
At the General?
I work at the General campus.
Okay. What do you see that reflects?
Well, you know, we see patients in hallways. We see healthcare workers who are stretched because the workloads are very high. The big thing is the hallway medicine that we see. You know, it's just not acceptable. And I mean, I have had family members too that have had need to use the healthcare system and spend long times in emerge waiting for service. And you know, you see the crowded emergency rooms. You see people waiting for services that they shouldn't have to wait for because there's fiscal capacity if the government was making choices that it's not making to fund the system properly. You see people waiting and suffering that there's no need for.